Welcome back, everybody, to the Guidewell Insights Lounge. My name is Kate Warnock, and we're here at day 3 of Singularity University's Exponential Medicine. I have a very distinguished guest here at the Insights Lounge, Mr. Patrick Littlefield. Patrick, welcome to the interview.
Kate, thanks. Great to be here.
We're happy to have you. Patrick is the director for the VA Center for Innovation. Patrick, today is Veterans Day. What more can the healthcare industry do to improve the lives of not just our veterans, but their families as well?
Great, Kate, thank you, great question. So first of all, it is Veterans Day, and I want to thank all the veterans for their service to the nation. You are the 1% that allows the 99% of the rest of us to do what we do. So here's to you, thank you for your service. In terms of your broader question around what can the healthcare system do, I want to expand that a little bit and talk about the Secretary's initiative, the MyVA initiative. So we are in the midst of a transformation process whose fundamental goal is to kind of re-architect and reinvigorate our relationship with veterans. So as a large federal bureaucracy, it's easy to kind of be out of touch, and the MyVA initiative specifically is seeking to say we need to be closer to veterans as customers, as people in the communities where they live, and in their lives overall. And there are a couple elements of that I want to touch upon. One of them is we're establishing a Veterans Experience Office, whose goal is to set up, among other things, more than 100 community-based organizations affiliated with our medical centers. So these community organizations are comprised of employers, educational institutions, local nonprofits, and the goal is to connect with veterans in the community. So if you ask where can the healthcare system help, it's in those local communities, and I encourage the healthcare system and the communities at large to be active, and we're going to be a part of those communities, but this is how we're going to get closer to veterans, and that's where we all live our lives. It's right, it's in the towns where we live and work, it's in the organizations that touch us day to day. So I think there's a lot of opportunity in that area.
Oh, it sounds like so. I'm sure that there's an upswell that you would be met with when you throw that out to the communities, that you're looking for more intersections with the veterans. I know that the communities will rise to that occasion, won't they?
Yeah, that's right.
Absolutely.
You also mentioned families. One of the things we're doing is we're setting up, trying to set up public-private partnerships, and this is often with nonprofits in the community, which may be able to play family support services or mental health services. But again, the idea is that the VA is a large federal entity and we're a creature of statute, right? So we can only do what the law allows us to do. But we believe that by integrating with folks in the community, that we can help them be more effective, and they can certainly do things locally that is beyond our legislative authority.
You know, and I think that approach, Patrick, makes so much sense. I've heard so much here at Exponential Medicine about how people can extend the reach of what they do through collaboration and partnership. So taking that community approach, again, I think just makes so much sense.
Right.
I have another question for you. You know, you're leading innovation in an organization that touches the lives of millions, but you're also, as you said, in this very, very, very large enterprise, aren't you? How do you diffuse or cascade new capabilities across the VA?
Right. Well, that's a great question, and I think that's a challenge that is endemic to innovation itself, because innovation is not just about the thing that is invented, it's about the change process and the adoption cycle by which you move it out into the world where it can deliver value to the folks for whom it was invented. So we're taking a number of approaches to that challenge. And I think the first thing you do is you have to segment in innovations into different kinds of innovation. So some of the large transformative innovation need high-level organizational kind of top cover and a push. So, and they'll need resources and kind of central level guidance and oversight. On the other hand, there's a wide variety of innovation that's taking place right now, right here today at the front lines. And we believe that there are ecosystems which can be developed that will facilitate what I call almost a market-based exchange of those innovations among the various hospitals, for example, who could benefit from them, across, and by building a pool of innovators who will communicate what's there, how they're doing, and this touches on something else that maybe we're talking about later, which is more broadly to develop a culture of innovation, that even though I am leading the Center for Innovation, no one entity can do the level of innovation that we as an organization need, continue to be effective, to be an agile contemporary organization. So I would say a couple of mechanisms. Top down, which is push, what I would say is pull, bottoms up, and the lateral, which is across. That's the what I'll call the exchange-based frontline model that we're trying to develop and support through something we call the Innovators Network.
You know, and that sounds to me like something that's so realistic for organizations not nearly the size of the VA, but have their own, legacy systems, their own ways of doing things, that, there are different ways to approach innovation so that it really can take root at the time and the place that it makes sense. Takes me to my next question then.
Okay.
What inspired you, Patrick, to take on the role of the director of the VA Center for Innovation?
Oh gosh. Well, that's a terrific question as well. So I was inspired initially by my predecessor, a gentleman by the name of Jonas Serwinski, who had a vision for a contemporary agile VA, kind of infused with all the good things that his employees could produce and that were being produced in the private sector. So Jonah reached out to me at a time when I was completing some work as an entrepreneur in the private sector, and I looked at this and said, gosh, I've always wanted to do something in the public space. So it was a terrific opportunity in the sense that you've got the VA is the largest civilian organization in the government. It's got a kind of a self-contained healthcare system. It's got some resources. I thought, what better opportunity to actually make a difference? And it touches on something I think is important, which is that we're a civil society, right? I use the term VA is the largest civil agency. Well, I believe that we're going to have a government. We want to have a good government. In fact, that a good government is a prerequisite for a vital private sector.
Right.
And I believe in both. So let's have a vital public sector, and that will enfranchise and deepen the vitality of our private sector.
Well, kudos to the VA for recognizing the talent that you have and that you bring to the organization, and your passion, your intelligence, and I'm sure the successes that you're going to cascade throughout the VA enterprise. So Patrick Littlefield, thank you so much for joining us here today at the Guidewell Insights Lounge. I also want to thank and reiterate the thanks that you gave to our veterans that Guidewell also extends to everybody who serves us. Deeply appreciate your service. My name is Kate Warnock. We'll be back up again with another interview soon.